Hello. Today I wanted to talk to you about a very important topic that has to do with impacting fertility. Matter of fact, this is going to be a three-part series. The first one, we're talking about how depression and anxiety, especially long term, can be impactful for fertility. And so we really want to take a close look at that. I did want to request, if you do like this video, please like and subscribe. But I did want to get back on topic here. Depression and anxiety, especially long term, is something that impacts a lot of women, can affect men as well. But when you are trying to conceive, as you know, it can also cause a lot of anxiety and stress, as well as depression when things are delayed. And so the importance here is making sure that if you are experiencing those aspects, that you take an extra step and talk to your doctor about the impacts, because a lot of times you're on medication. So if you're on SSRIs, the serotonin uptake inhibitors, you'll want to double check with your doctor and make sure that it's not going to impact fertility. A lot of times when we are on medications from our MD, if we're working with a fertility specialist, they don't always know these medications and how their impact could affect fertility. And some of them do. And so that's what I usually ask any of my patients that are curious as to whether their medications could, well, actually, what I'm curious about whether their medication is going to impact them is to do a search on drug.com and really look down, scroll through all the different symptoms that can be expressed, as well as things that you want to be aware of, precautions. And I think that's the best thing to do, because your doctor may be absolutely awesome and be aware of those things, but sometimes we forget to tell them, oh, by the way, I am trying to conceive right now. Is that going to be a factor? Will that impact me being able to conceive? And this also goes for your partner. I've worked with patients before where they were on antidepressant therapy and their doctor didn't know they were trying to conceive, and it was the husband. And so he'd never said anything to his doctor, and they just assume that it's probably okay. But then when you look at the fine print and actually scroll down through drug.com, you'll find out, oh, look, this actually will impact male sperm, will lower sperm, will impact the actual percentage of sperm that are present, or maybe even have them be more malformed. And so it's really important to do your research and make sure that everything that you're taking in is really safe for you. And I'm not saying jump off your antidepressant. I'm saying make sure you talk to your doctor, let them know that you're trying to conceive. And if there is anything that implies problems with the conception using that medication, is talk to your doctor about another option, especially if it's long term. If you're having more mild depression and anxiety, then maybe doing some other things would be more helpful in that case. Whether it's, and I always encourage people to change their diet. I talk about diet a lot, but a lot of times these things come up from insufficiencies in certain nutrients, and that can definitely make it much tougher for your system to navigate and for you to feel better and to not have so much stress and anxiety around the different things that happen in our lives. And there's certainly a lot of things that can contribute. And so that's one thing I wanted to talk about. There's also taking steps like psychotherapy, or going that step where they'll actually do more cognitive therapy and make sure that some of the ways you're thinking about things maybe can get rearranged where they're not such stressors. So that's one thing. The other is actually doing what's called an OAT test, OAT, and it's for organic acid testing. And what that does, it's actually a urine test, but it looks at the metabolites of your urine, and that's where you're looking at how many vitamins are actually broken down, vitamins and nutrients. And so sometimes we don't even know our body's not absorbing those things very well. And if you have a history with GI tract problems, that can definitely interfere if you're not breaking things down well. And so having a notes test may give you more good information for what you need to add nutrient-wise to your diet, or make sure that your digestive system is working well. But a lot of times it's the B vitamins that get depleted. And so when you're trying to get pregnant and you're having deficiencies, it could be folate, which most people are familiar with, B12, also B6. And your iron, your vitamin D, your some of the other ones I wanted to mention too that can also be depleted, magnesium, zinc, and omega-3s. And so those are other ones that you have to be mindful of. If you're already taking them, then it's a matter of, am I absorbing them? And so you may either have to kick up your nutrients a little bit or help your digestive system work more effectively. So that could be checking for inflammation there, making sure you're taking digestive enzymes with your meals, not adding water because it dilutes the good enzymes to help break things down. And when you do take your vitamins, a lot of times it's better to take it with food. So you'll do it first thing, drink your water, take your pills, and then start eating. And that can actually help the breakdown and assimilation of those nutrients much better. The other thing I wanted to mention is with your vitamins, a lot of times we want to take things that are not so costly, but the fillers can be plentiful in the ones that are cheaper, which is unfortunate, but true. And so a lot of times the fillers can actually get in the way of how well you digest those. They can actually block absorption, which is crazy because you're taking this to help you get better. So the ones that you want to be mindful of is magnesium silicate, magnesium stearate. Also, some of the other ones would be more of your titanium dioxide, maltodextrin, which can mess with your blood sugar. So if you're already having problems there, you want to be mindful of not adding that to the equation. And then also microcrystalline cellulose is another one that they use as a filler, and that can also get in the way of absorption. So check your bottles, look at those other ingredients because they'll give you the vitamin ingredients, but below that it will show you added ingredients or fillers. So you really want to look at those and make sure that's not getting in the way of you getting the nutrients that your body needs, especially when you already are noting some that it's deficient. The last thing you want to do is add to that deficiency and be buying nutrients that are really not doing you any good. So the last thing I did want to mention is also foods that can impact your absorption. And so that's your processed foods, because they also are full of a lot of things that are not going to help your system work very effectively and also rob you of the nutrients you need. Sugars, so you're trying to avoid any of the sugars in alcohol, in your desserts, in your drinks, in processed foods, because a lot of times they load them up all over the place. And so if your sugar is getting higher, that can also cause more inflammation and more problems with pregnancy, but it's also something that's not going to be so great when your body's trying to deal with depression and anxiety. So really be mindful there. Also, the other part of it would be your caffeinated drinks. Most of you avoid that. Sometimes doctors will say, oh, you can have a cup or two, but I would say try to really reduce those, especially with anxiety. You don't want to really be making yourself more anxious, and sometimes caffeine has that effect. And then lastly, alcohol, which most know not to do. Sometimes they'll do a little bit. I would just say again, if your system is not working as effectively as it needs to, it may be time to just stay away from that altogether. If you have one drink, maybe on the weekend, that is a small glass of wine or something like that, it may be okay, but just note how you feel afterwards. If it feels like it's making you more anxious, making you more depressed, I would say just avoid it altogether right now. It's not that all these things are forever, it's just you're trying to set up your system to be in the best state it can for you to conceive. So I'm going to end there, but just know that I am going to do a series. Next one's going to be about relationships and how sometimes the battling grounds that it feels like you're having there can really impact or block in some ways your ability to conceive. So please stay tuned for that next one, and I will see you soon. Take care.